The SWOG 1826 trial was really a landmark trial that we initially reported high-level results at the ASCO meeting earlier this year. This was a trial that enrolled almost 1,000 patients with newly diagnosed advanced stage classic Hodgkin lymphoma and randomized them to either Brentuximab-AVD or Nivolumab-AVD. And primary endpoint was progression-free survival. And we previously demonstrated that in the entire trial there was a substantial benefit with only 1 year of follow-up to the nivolumab versus the Brentuximab with a decreased toxicity profile. One of the unique things about this trial is that it enrolled patients ages 12 and above. And this is the first time in the United States that pediatric patients and adult patients were really enrolled on the same trial in Hodgkin lymphoma and treated the same way. Previously, the pediatric regimen backbone was a different backbone. So at this ASH meeting, we presented a subset analysis of the pediatric group. And there's a substantial number of patients, about 25% of the patients on the trial were in this group. And we showed that the trend continued, that the nivolumab did have improved progression-free survival compared to the Brentuximab arm. Not surprisingly, the pediatric patients did better overall than the older adult patients, because you would expect that. And importantly, we demonstrated that both regimens were well tolerated. There were slightly more immune effects and withdrawals of nivolumab in the pediatric patient population compared to the adult patient population. And that may be due to immune system differences in the patients or decreased experience using nivolumab by pediatricians, whereas adult physicians have been using this drug for a long time. But based on this subset analysis, the pediatric groups have agreed that this is poised to become a new standard of care for the treatment of both children and adults with advanced stage Hodgkin lymphoma.